Okay. Okay. Hi, everyone. Welcome back to another edition of Wellness Wednesday. Happy hump day. Thank you so much for spending your lunch hour with us. I hope that you came hungry because we have a lot of material to quench your curiosity with. As you all know, today's session is centered on the topic of our ever elusive hormones and the spectrum of ways in which they impact us on a physical level, chemical level, a cellular level. We call today's session Hormones. It's not all in your head because it's in your head and it's everywhere else too. It's actually quite fascinating when you do a deep dive and you learn the ways in which estrogen has played such an instrumental role in the way that uh, parts of our body function outside of the reproductive system. They've long been stereotyped, in very singular ways. They're the things that haunt us during, PMS, and they come back with the real vengeance in menopause. But of course, they come out during those times, but they're also present in puberty. They're present in pregnancy, postpartum, perimenopause, postmenopause, every single life stage that a cisgender woman experiences. Um, this is evidence of hormones right here. These are my baby hairs after my hair fell out post baby. Anyways, I digress. So we are only beginning to scratch the surface, understanding that hormones are really an ever moving target. They're responsible for the changes in our gut health. They can regulate the turnover in bone growth. They can influence our mental health. In fact, I dug up this stat here. The Mayo Clinic recognized premenstrual dysphoric disorder in the 90s, and this is a condition that has actually existed for ages. And you add to that, the first antidepressant drug to treat postnatal depression was just released in 2019. As women, we've been told that hormones are just something that we have to deal with. So we sort of customize our plans around the ups and downs of them. And that's something that men don't really have to give a thought to, although, yes, they do have hormones too. Women go to the doctor with symptoms, and there are many instances in which these symptoms can be tied back to fluctuations in hormonal levels. They have a real grip on us, especially the big two, which is estrogen and, progesterone. However, while we feel as if hormones have a complete mind of their own, there are ways that we can work with them sort of in our favor. And that's what brings us to today's guest. So Dr. Tolu Oyelo teaches obstetrics and women's health, along with a myriad of other topics pertaining to health in women. She is a leader with a trove of accomplishments, and among them is the Guide to Women's Health book. She co-authored that with Judy Johnson. That was published in 2018. There's a nice little picture right there. And she also penned the Guide to Women's Health, a handbook for health professionals, in 2007. She's literally written the book on women's health. So we have a prized gem with us today. So she is an expert when it comes to the science of hormones from life stage to life stage and natural ways in which we can keep them balanced, when we find ourselves in a sort of hormonal funk. But let me just add and be clear right off the top that, the advice and the insights that she shares with us today can't be replaced with the trip to your primary care provider. So, in the event that your hormones are causing your health to really suffer, just know we're not a substitution for the doctor's office. Make an appointment. We're just a vehicle for information to kind of help empower you as an advocate for your own whole body health. So before we dive in, Northwestern Health Sciences University is based out of Bloomington. That's today's sponsor, and they are the leading chiropractic school in the Midwest, but they're more than just chiro. They offer all sorts of degrees in natural health. They have a clinic on site, which is open to the public, where, you can get natural care services like acupuncture, you can get cupping done. various, forms of Chinese medicine, massage therapy, and so much more. Their faculty and their providers are just stellar. They are A plus. They're industry experts, and they are really paving the way for natural health and revolutionizing the ways that we think of healthcare. And so before we bring in Tolu, just one quick housekeeping item. Be sure to drop all of your questions or comments in the Q&A. We won't save your questions to the end. We want this to feel very conversational in nature with you guys. So jump in at any point, and we normally hit every single question along the way. And just know that no question is a bad question. We are all sort of new. I mean, hormones, just as a subject matter in general, that's kind of the things that we're learning about it is sort of a new phenomenon. So we're all sort of learning this together. So without further ado, I have the great privilege of introducing Dr. Tolu Uyelo. Today, she will be walking us through the science of hormones, particularly through the stages of premenstrual, postpartum, and postmenopausal. So welcome, Dr. Tolu.
I'm so excited to be here, Jamie. Thank you for inviting me. Thank you for having me.
Thank you for being here.
My pleasure.
Let's start with kind of the basics, and we'll work our way up. And when I say basics, I mean this is something that afflicts all cisgender women. And I want to know, can you explain to us what is happening? Can you kind of walk us through on a hormonal level, the things that are occurring within our bodies in that month of the menstrual cycle? I know it's so much more than the 2 weeks leading up or the 2 weeks after, but there's so much that goes into that entire month. If you can kind of describe that to our audience today.
Oh, absolutely. So first, I'm going to change the word afflicts. Because I think that we think of this thing as a curse, but this is the reason why we live, why we propagate, why we continue to exist. So this is the price we pay for the joy we have of moving life forward, as they say. And so, short answer to your question then, so what does happen over the course of the menstrual cycle? I will start with the bleeding phase, and I'm gonna, your introduction talked a little bit about estrogen and progesterone as sort of being the anchors. And I really appreciated you saying that, because estrogen is the reason that we continue to propagate as a species. So it really is a very significant hormone in our existence. So anyway, all of that to say, menstrual cycle, those two hormones are at their lowest. And they become then a trigger to the parts of the brain that will secrete the precursors that begins the rest of the menstrual cycle. Allow me to use some technical words just for a few minutes. Follicle stimulating hormone, whose job it is from the brain to cause growth within the ovary, and also secretion as those cells mature of estrogen, first half of the cycle. Those levels of estrogen then increase and then become a trigger also again to the brain to secrete the hormone luteinizing hormone, which is what is going to cause ovulation, the release of the egg. Post-secretion then, the remnant of that release, also known as the corpus luteum, secretes both estrogen and progesterone. So what I want you to take home from that is that the first half of the cycle is primarily estrogen derived. The second part of the cycle is primarily estrogen and progesterone. And the reason that that is significant is because that balance in that second half of the cycle oftentimes can cause major challenges for many people. And so maintaining some kind of balance, that second half of the cycle is also quite significant. So let me also now pause and say one more thing about this whole process, is that it all starts from the brain secretion of a hormone called gonadotrophin-releasing hormone. Gonadotrophin-releasing hormone is secreted in pulses. It's a rhythmic type secretion. And the reason for that is important is because if you think of things that are going to throw off your rhythm, throw off just your body mechanics, stress is a big one. And altering that rhythm of gonadotrophin-releasing hormone is a way really to start to throw off the menstrual cycle. So when your menstrual cycle starts to go awry, rather than get frustrated and annoyed that it's going awry, perhaps ask yourself instead, that what are the stressors in your life that are causing that to happen, and start to mitigate for those stressors, as opposed to getting even increasingly frustrated about the menstrual cycle going funky.
Thanks, Tolu. Dr. Tolu. And
Tolu
thank
is just fine.
for correcting my language there. You're so right. Afflict, I mean, that has some negative connotations. But that's, you know, like you said, we propagate. That's the reason why we're all here, because of our mamas.
And Jamie, I can say that now because I'm non-menopausal, so I don't do that anymore.
Okay.
It's not afflicting. It doesn't feel like that affliction anymore to me. So anyway, go ahead.
I'm interested in the stressors that you talk about. Could this be something as simple as I'm not getting enough rest at night and that's throwing my entire cycle off? Or is it more mental? What does that look like? I remember in high school, my cycle being late because of exercise, that threw it off. But I'm just wondering if you can like maybe name off some of those primary stressors that could be impacting the timing of all of that.
Well, you just did, right? I think sleep is so huge, and exercise. Those are two big ones. We think of exercise as being a good thing, which it is most of the time, but too much exercise, too intense of exercise can also be problematic. One of the things that happens with estrogen synthesis is that estrogen is synthesized primarily in the ovaries, but it's also synthesized in peripheral tissue, fatty tissue, bone, hair, skin. So these peripheral organs. And so when you think in terms of exercise, well, yes, that's a stressor in itself if it's overdone, but it's also problematic if you think of the estrogen synthesis and fatty tissue. We do need some fat, right? And I think that oftentimes we think of fat as the bad guy, but there too much and a significant excess of fat is probably not ideal. It's not ideal, but there are many times when we do need some fat for appropriate hormonal function.
That brings me to my next question, Dr. So as you know, today's session is inspired by an article that we published last summer, and that's called The Hormone Digestion Connection. And we can add a URL in the chat box below shortly. And that delved into the bloat and the constipation that sort of rule our digestive system from month to month. What can you say about how digestive issues correlate with a woman's time of the month, and how can we sort of better ease our diet or lifestyle going into that time so that we don't have to suffer from extreme constipation or bloat or other stomach upset issues?
If I can again answer the pre-question and then the actual question that you just asked. So rather than approach things from during that time, I would say back is that what are just some general lifestyle habits that we can adopt that will help with bloat and all of those types of things. And so what I mean by that is to say, generally speaking, how about a whole foods diet? How about grounding our diets and primarily fruits and veggies, and then adding other things to that? Generally speaking, how about we make sure that the water we're drinking isn't containing pesticides, it's relatively clean water. So these sort of broad generalities, how can we, and as much as we can, eat organic food so that, again, we're not having to manage the estrogen disruptive parts of things like pesticides. So my point being that they're, in part because estrogen is such an important hormone, estrogen receptor sites are pretty much everywhere and can be sensitive to estrogen mimickers, so to speak, estrogen lookalikes. So half of what we should be doing, in my opinion, is making sure that we are not adding to our system estrogen disruptors in our diet. And yes, I'm going to make a plug for eating organic wherever you can. I think you should. And then avoiding the chemicals in the home as much as we can. I think we should. And now, Jenny, to your specific question about things like the bloating and the constipation and those types of things. So now remember that two quick things. Estrogen is I'm going to use the term sympathetic nervous system stimulator as a broad term, meaning that high levels of estrogen will oversensitize the sympathetic nervous system, and the converse is the case. It's this circle that plays on itself. Too much estrogen, hypersympathetic nervous system, hypersympathetic nervous system, too much estrogen. So that cycle, and that can lead to some digestive irritation, sometimes loose stools, sometimes abdominal cramping. So again, back to what you said earlier about regulating those basic functions, making sure that we are not overly excited, overly anxious, kind of managing our lifestyle. Progesterone tends to slow the gut down a little bit. And so that might in itself facilitate constipation. So while we don't necessarily want to cut down on the levels of progesterone, actually we just don't, at least in that premenstrual time. But we do want to be watching what we're eating around that time to make sure that we are introducing things into the diet that would allow for gut motility, that won't slow down gut motility even more. So the more easily digestible things are, the better. And then of course, adding in moderation, some of those things that will help move the gut in terms of fiber.
Perfect. We have a question from our audience
Sure.
here. And this is going back to when we were talking about the correlation between fitness and our cycles and how too much of it can throw everything out of whack. So finding balance is key. Melissa says she's heard that exercise can also raise cortisol, that's the stress hormone, and that in turn affects weight loss. Is there anything that you want to say about that, Dr. Tolu?
Yeah, I do. Thank you for asking that question. Absolutely, uh, cortisol does impact weight loss, and exercise can raise cortisol. So the more intense the exercise, the potential for let me back up a little bit because I have spinning in my head, and unless I could get that out, and my brain is not going to allow me to say anything else. Because I love spinning. I love a spin class. But if you've ever been in a spin class, you know that these are high energy, high intensity type.
Yes, this is a hit class on hormones. I love it.
But yeah, exactly. But the thing about this is that yes, cortisol is also a strong component of stress. There's good stress and there's bad stress, but the bottom line is that it is secreting, you are getting a cortisol secretion from the adrenal glands as well during those high intensive exercises. So why am I going there? Estrogen, again, coming back to this whole estrogen issue, all roads point to estrogen. Now, what I mean by that is that many of the other hormones that the body makes can be converted to estrogen. So there is always the risk of creating estrogen dominance, even when you're trying to work against it. So in answer to your question, the other part to the equation is where your aromatase enzyme is functioning. That's a fat-derived enzyme that also helps to synthesize estrogen. So yes, there can be too much exercise. And the way I would say to deal with that is to counter it with the exact opposite. So if you're the person who loves to do spin all the time, then maybe you should also go take a yin yoga class. If you're a person who likes to run a lot, maybe occasionally you want to spend some time taking what my friend calls a forest bath, spending some time in the woods, just walking a slow walk. So yes, short answer to your question is that could be too much of a good thing.
Okay, great. We have another question from the audience, Dr. Tolu, and that is, it seems many doctors do not treat or have awareness on hormone management, often recommending alternative things like thyroid testing, prescription medication, things of that nature. How would you recommend? Oh, this is a great question, especially when we talk about kind of empowering ourselves before we go to the doctor's office. How would you recommend somebody having a conversation with their doctor to understand their hormone issues, or to find a doctor that will comfortably engage in those conversations?
There is no simple answer to hormone issues, period. So let me just start there. When I think of hormones, I really think of the solar system, right? It's all of these connections, and one little bit affects another little bit. So yes, medically speaking, oftentimes what is done is some testing, thyroid function, you know, hormone assessment testing. I think the way you arm yourself is to first know yourself, and that you really have to start with. I love the idea of keeping a 30-day calendar, sometimes even more, if depending on what the symptoms are, if it's a 3 to 6 month thing. Keep calendars so that you can go in with an explanation of when you get what, right? So this happened, and this is maybe what I ate. This is maybe what happened in my environment. This is what happened at work, so that you start to fully understand what your triggers are. Because quite frankly, like we just said, sometimes those triggers are good things. It's like too much exercise. It's like eating too much citrus fruits. The triggers can be very curious anyway. So I think the first step is to invest in yourself first, and know yourself first, and know what your triggers are. And then know that there are lots of practitioners out there who take different approaches to hormonal health. I strongly encourage getting an opinion from more than one type of practitioner, because again, we all come at it from the angle that we affirm the most. So yes, talk to your medical doctor. Yes, talk to an acupuncturist. Yes, talk to a naturopath. Yes, talk to a compounding pharmacy, but make sure that you are talking to more than one person, and that you can give them as much ammunition as possible, because you have learned enough about yourself that you know what your triggers are. Did I answer that question?
Oh,
I may have gone off topic a
no,
little
you
bit,
did.
but okay.
A reminder, and I'm going to speak for myself here, but I suspect other people may relate to this. It's just, when you experience symptoms, you get frustrated, and it kind of turns into an afterthought after it's come and go. And so holding yourself sort of accountable and quantifying things makes it feel more accessible. Like, okay, let's do it could even be the universal pain scale, like today, smiley face, tomorrow, whatever, sad face. And I think that's just even if it's not hormonal related, whatever it may be, that's such an important tool that you can have in your toolbox when you go to your primary care doctor for things of all nature.
And if I could just add one other piece to that, is that please hear me say that there's no one quick fix to anything hormonal. And so if you're going in looking for that, you will likely get a prescription that might work for 3 months, and it might not work after that. There's just no one quick fix. So just keep that in mind as well, that it's not an on and off switch, that something can be given and all will be well.
Perfect. That's such a great response, Dr. Tolu. My next question from the audience is, could you please, so we haven't really tapped into menopause, it's been more kind of premenstrual. This person wants to know, could you please address whether menopause/hormonal changes can trigger, oh, this is a good one. I was actually going to ask this. Hormonal changes can trigger low blood sugar issues. And if so, if there's that correlation there, how do we go about with managing that? Oh, that's a great one. Marja or Maria, that's a great question. Thank you for asking.
Yes, short answer to your question is yes. Those changes can invite problematic issues with blood sugar regulation, because those again, estrogen is uh, influential in the insulin response. So absolutely, yes. So how can you address that? And I will say again, when it comes to menopause, ideally you're addressing menopause in the perimenopause. I'm going to pause for about 30 seconds so I don't forget to say this. When you look at the hormones over the course of a lifetime, over a sort of take a life course approach, what you see happen is, during that puberty stage, you see this really erratic patterns with the hormones. And then you get into the reproductive phase and things tend to settle down a little bit. But then you get into perimenopause again, and you see this really erratic cycle begin again. And then you get into the menopause and things settle down again at a lower level. So my point being that during that perimenopause, the hormones are boom, 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 all over the place. And that impacts insulin sensitivity, insulin reactivity, and blood sugar levels. So managing for that really should begin sooner than you get to the menopause. That's the time to be working on, making sure that you're treating yourself as if you're a pre-diabetic, even if you're not. Meaning that you want to manage what you're doing by way of sugars. You want to manage, again, what the stressors are, and you're making sure that there is good clearance in the body. What I mean by that is back to those fruits and vegetables again. Every once in a while, at least once a year, I'm going to recommend that you do 10 days of fruits, vegetables, and clean water, and just allow your body to detox, to clean, and to level out. By so doing, enhancing both pancreatic function and the function of all of the other glands, also in particular the gut. So how severe are the blood sugar issues, I guess is what I would ask. Are you fully in a total hypoglycemic state? Is it sort of an in and out? If it is pretty significant that you're keeling over, you're fainting and those types of things, then you really do want to get care for that to help regulate those blood sugars. But if it's mostly that you're fatigued, or that you are, after you eat, you get really, really tired, then that really can be controlled with diet, quite frankly, is eating small amounts all throughout the day, making sure that you get enough to keep those levels up. Yeah, and then not eating foods that will cause you to crash, a couple of hours after eating.
Thanks, Dr. Tolu. I am going to speak on behalf of breastfeeding mamas out there. So I don't know how long you're technically considered to be in postpartum. I don't know if that's the full year after baby, or it's just as long as you breastfeed. But noticed that if I go on like a walk and I haven't eaten that much, I will get faint. And I always wanted to know, that was a question that came up last week, if there was any correlation between hormone fluctuation during breastfeeding and blood sugar levels. And so I suspected that there was a link. And so now I've gotten better at bringing snacks with me if I'm going to be gone for a while. Is that true?
That is true. That is true. So the first part of what you said there, which is the postpartum, and especially if you're breastfeeding, by the way, kudos to you, right? But also remember that you're giving a lot of yourself in that. And yes, you can easily a full year. I don't know how long you've been breastfeeding for, but easily a full year. And again, those estrogen and progesterone and prolactin levels are all fully interrelated and need to be refurbished. And I guess that's the other part that I would say to this is that it is not necessarily a problem, right? It is your body just needing to do what it needs to do and needing a little bit more from you because of what you're giving in terms of the breastfeeding. Does that make sense? I think that we want things to be the way we knew them to be, right? And your body is simply saying to you, I need a little bit more right now. And as long as I'm doing this, this is what we need to do to maintain. So you've figured it out that you take a snack along with you so that you don't keel over in the middle of an evening walk. And maybe that's the other part that I will just say is, and again, forgive me if I'm sounding old. I'm going to call it wise, but I think that part of it is we need to grant ourselves some grace and grant the body some grace to make the adjustments that it needs to make based on the current circumstance that we're in. And I say that because of, I see that postpartum phase as another transition phase, right? Very similar to the menopause phase, which is also a transition phase. And the body has to do that transitioning. So to permit it to do so, I think is really important. When a child is learning to walk, we don't get impatient when the child falls periodically as it's learning to walk. That's part of the strengthening that it needs to do in order to master the art of walking. And I think all of these transitions in life are just that. They are transitions in life. So allow the pain of the fall, those occasional falls, as we walk through that phase onto the other side. Now, when it becomes significantly problematic, right? If there's syncope, if there's significant depression, then we do need intervention, but not always.
I love that. Giving ourselves grace in between the transitions. That's very beautiful. We have another guest who wants to know. She says her daughter has been diagnosed with PCOS. So is that polycystic ovarian syndrome?
Yep.
Do you have any recommendations to manage this? I know that there are different types, but perhaps you can speak a bit about this. I'm guessing she's thinking within the greater natural health realm.
Yeah. PCOS is a stickler, right? It's one of those really challenging conditions. So I will first say that the vast majority of people with PCOS, not all, but the vast majority, tend to have an insulin dysregulation problem. And so I would start off by saying, approach the management of that blood sugar dysregulation first. The second thing I will say is that patients with PCOS tend to also have then some infertility issues, obviously with the polycystic ovaries. And the question then becomes, how do we regulate that cycle so that she becomes ovulatory? So usually the approach to that, in the nutraceutical route, I guess, would be to use something like progesterone creams. I'd also encourage seeing an acupuncturist. I'd also encourage a visit with a chiropractor to take a look at both the supporting muscles of the pelvic girdle as well as the pelvic girdle itself and the low back. Those adductor muscles, which are the muscles of the inner thigh, are oftentimes very hypertonic in that patient with PCOS. And the thinking is that there's a neurosomatovisceral connection. What I mean by that is that there's the nerves that supply the ovaries. Some of them also supply those muscles. And so that whole connection is needing some help. And then, of course, there are the medications that might be necessary for PCOS. Now, let me say this. So of the list of the things that I have just given, I would really start with the blood sugar dysregulation piece and try and get those blood sugar issues under control. But let me also say that one of the things that we're learning about cystic ovaries is that the problem can begin in utero, between the relationship between the fetus's adrenal glands, the placenta, and the mother's endocrine system. So why I say that is that for some, regulating or resolving PCOS might be a very, very long journey because those cysts have been forming since they were 2 and just didn't happen to get diagnosed until they were 22, right? And so the question to ask, I would say with PCOS is, what is the ultimate goal? If the ultimate goal is fertility, is to be able to have children, then there are some medical approaches in terms of pre-diabetic drugs that can help with that. If the goal is the pain or cycle regulation, again, like I say, there are some other approaches, estrogen creams, progesterone creams, dietary precursors that might also be helpful. If I didn't say acupuncture, I should have said acupuncture as well.
I think you did say acupuncture. You
Okay.
covered a lot, Dr. Tolu. Thank you so much. Our next question is.
Hi, I'm Tom Lehman, and this is My North.
Sorry about that. Somebody was crashing our Zoom for a second. I was trying to find the link to our YouTube page to send to one of our audience members. So Sarah wants to know, she's been on a couple of these before. Her mom has ovarian cancer, and just yesterday she had her total abdominal hysterectomy surgery. She is postmenopausal. Will there still be hormonal effects to her after this type of surgery?
So she just had a total hysterectomy. Is that what you just said? Everything was removed.
Yep.
Okay. So tell me what you mean. I guess my follow-up question is, what do you mean by, is there hormonal effects? If she's had the ovaries completely removed, if you're asking, can there still be hormonal synthesis outside of the ovaries? The answer is yes, but I'm not sure what you, so yes, removing the ovaries does impact the vast majority of hormones, but there is still hormonal synthesis outside of the ovaries, if that's, yeah, I'm hoping I'm answering the question.
She just replied and said yes.
Okay, all right.
Perfect. Okay, let me see here. The questions keep coming, which is so great. This is what we desire to. We have an attendee that says, I had early ovarian failure in late 30s and was put on, and Dr. Tolu, we talked about how HRT, hormonal therapy, may get brought up. So she was put on HRT, estrogen, and progesterone in her early 40s to manage irregular bleeding every few weeks. Now she is in her early 50s and not sure how long is safe to stay on HRTs, or if she can do something natural now. Getting mixed answers, including hysterectomy, depending on which doctor I ask. I'm curious about what you think.
So I'm going to ask again the question. I'm going to ask first the question behind the question, right? Before the question, and that is, premature ovarian failure can be genetic, right? It could be, but it can also be environmental. And I don't know if this is something unique to you or to your family. But if there's a possibility of a history of being around strong environmental toxins, some industry, again, around pesticides a lot. I don't want to name a specific industry, but there's some very small studies that have associated premature ovarian failure and the dry cleaning industry with the chemicals in that environment. So I guess what I'm saying to you is that the first thing I think is be sure that there aren't environmental things that impacted the premature ovarian failure, and address those, because of clearly your body is sensitive to those environmental issues. Now, having said that, yes, estrogen replacement therapy is oftentimes the treatment of choice for early stage ovarian failure because of all the added benefits of ERT, bone health, heart health, eye health, brain health. There are some clear advantages to having estrogen replacement therapy. But I hear you saying now you've been on it for about, sounds like at least a decade, maybe a little bit more. And in your mind, you're thinking, do I want to continue with this? So you're now in that phase where the ovaries would be, quote unquote, shutting down anyway. And so you then need to ask yourself the question, what are the benefits or not of staying on estrogen replacement therapy? we know that depending on the dosage of some hormonal replacement therapies, there might be some other issues that arise. I don't know if you're getting breast tenderness. I don't know if you're getting any kind of liver issues. I don't know if you have any history of clotting. But those are some of the challenges that may arise with long-term use of estrogen replacement therapy. And if those are concerns for you, then it's worth a discussion about whether it's time to start to wean yourself off. You should know that oftentimes weaning yourself off will create some of those symptoms that come with menopause, the hot flashes and the like, and extend yourself some grace again if that's a decision you're going to make going through that. But if the answer to your question is, should I continue to use estrogen replacement therapy? The way I would respond to that is to say, what is it you want to gain from it at this point? What kind of family history do you have for osteoporosis? What kind of family do you have for cardiovascular disease, cardiovascular conditions? And then go in with those questions to your prescribing person and get who knows your history a little bit better and get the answers to those questions based on your personal history and your family history. And your willingness perhaps to deal with the consequences, usually symptomatology of coming off of estrogen replacement therapy. It really is a symptom type of thing. It's how long can you deal with those symptoms of weaning off of estrogen. Yeah, enough said.
Okay, our next audience member wants to know, she's wondering about the correlation between hormones and sugar. She says, I hate to admit this, but I've self-diagnosed that when I'm ovulating / in between periods, even a little sugar or alcohol later in the day or early in the morning makes me really sick, like a 24-hour flu where I can't keep anything down. Is it possible that certain times of the month could be interacting with sugar at certain, let me repeat that. Is it possible that certain hormones can be interacting with sugar at certain times of the month and actually make my body allergic or make my body reject it? One of my friends has a similar problem.
Yes. Insulin, like I say, insulin regulation is directly correlated with estrogen regulation as well. And you'd be actually a great patient for an acupuncture appointment and get some of those dysregulation issues addressed.
Perfect. Kelly wants to know, is it true that perimenopause can last up to 10 years?
Yes, it is true. Some women go through perimenopause, and then into menopause overnight. Also, it feels like over a few months. And for some, it's this very long and sustained process that could be anywhere from, vaginal dryness to start off with, to irregular cycles, to really, really heavy cycles. But the answer to the question is yes. Perimenopause in some women lasts a very long time, and 10 years is about right, and can start as early as age 35. Quite frankly, it usually starts a little bit later, but for some women, can start as early as age 35 and last for a very long time.
So are you saying that 10 years, is that kind of, if there is an average or a benchmark, is that pretty normal?
No, I'm not saying that it's normal. I'm saying it's not abnormal. I would say for most women, perimenopause is a maybe 2 to 5 year thing, but perimenopause lasting 10 years is not uncommon either.
Okay, great. Excuse me. My next question, well, it's not my question, it's somebody else's question. How does someone who enjoys HIIT workouts, very funny because we're talking about high intensity interval training and hormones, who enjoys HIIT workouts, monitor and assist the hormone fluctuation that happens right before menstruating? Is rest part of the ticket?
You know what, can I just say something about women's health that just really, this question has just brought to bear, is that one of my biggest take homes from all the time I've spent doing women's health work is that intuitively women know exactly what's wrong. And they even know how to fix it. They just simply need affirmation. Because that question included the answer, right? You said, how do you know? Is rest part of the ticket? That is your innate telling you that rest is part of the ticket. And so, yes, you absolutely have to modulate those high intensity exercises with mindfulness and mindfulness type practices. So, whether it is a meditation, whether it is a prayer, whether it is yin yoga, whatever it is, but those have to be countered with a more grounding type of work. And especially if you're noticing those symptoms occurring right before your menstrual cycle. I don't know how oftentimes you do those high intensity type exercises, but if you're doing them, say 3 times a week, then during that 2 weeks, that the week leading up to your menses and the week of your menses, maybe you want to cut that down to 1 and replace it with something that's more grounding, more centering.
Balance seems to be
Balance is the theme.
common thread in a lot of the answers to questions.
Yes, yes.
And you're so right. I mean, we do intuitively, subconsciously sometimes know that something's wrong, and what the answer to that may
And how
be.
to
But
fix it. Yes, yes.
right. The next question is one that I think many will relate to and appreciate your response to, and that's: is there anything that you suggest for hormonal cramping, cramping that's actually quite debilitating, that happen regularly with periods?
Yeah, yeah. So let's start with diet. So with those really heavy, painful cycles, I'd start with diet. And the inflammatory prostaglandins are necessary to help expel the blood. But again, too much of a good thing is problematic. And so what you want to look at are some of the things that you might be eating that are precursors to those inflammatory prostaglandins. And red meat shows up, right? Dairy shows up. So maybe cut back on some of those things during or right before your cycle. Then think of the things that are anti-inflammatory in their makeup. And that's where the fish oils really come to play, where the green leafies come to play. So include those things in your diet to also help with balancing the pro and the anti-inflammatory components. Think of things like ginger in a tea. That might also be helpful. So in terms of diet, those are some of the things that I would look at. But then there are also lots of other reasons for why you get that intense cramping. And from the chiropractic perspective, what we're looking at is the pelvis and the lumbar spine, that low back, and all those muscles and nerves that both innervate the uterus and support the uterus. And can we make sure that those are in proper alignment and in proper balance? So let's make sure we do that. And it also might be things like having at your feet. Is the leg length imbalanced? Is your pelvis sitting on an unlevel surface so that those muscles that attach from the pelvis to the uterus are constantly under some fair amount of strain? And also think about the massage therapy component of those. Those are really, again, your muscles are asking to be relaxed. And so getting a massage around that area in particular, but also a full body massage to help relax you as a whole might be helpful. Again, the acupuncture lens, balancing those meridians can also be helpful. But I would absolutely start with the diet piece and regulating that and balancing for the inflammation.
So Tolu, we're talking about balance and eating leafy greens and taking fish oil pills and staying away from red meats and dairy, like you were saying before, kind of cautioning against some of that stuff leading up to menses. Is it okay if, I mean, this time of year, I really crave carby stuff that's really warm. And I feel like so many of us kind of have this all or nothing perspective. We think we have to be perfect when we adjust our lifestyles, down to a fine science, but that's not always the case and that's not realistic. So what if I have a couple of salads and, fish or whatever, but I also have like a slice of banana bread. Like, that's
I
fine,
think
right? I
I
just,
think that's absolutely fine. By the way, I think you just touched on something that I think is really important, which is it is not an all or none. And again, balance is the key, is that it's just a question of leaning more towards one thing and then leaning as opposed to leaning towards the other, right?
sure.
And not yeah, don't deprive yourself of all that's good in life. And especially if your body is asking you for it, if you're
Right.
craving it, you need it.
That's so
And let
true.
me also just say one more thing along those lines, because you reminded me of the fact that, many of us are calcium aware, I guess is what I would say. But when it comes to muscle cramping and those intensity with periods, magnesium is equally as important, if not more important. And so just making sure that that calcium magnesium balance is a healthy balance, and maybe even considering supplementation with some of the magnesiums or the B6s or the zincs, some of the cofactors in uh, the synthesis of these anti-inflammatory type compounds.
This is a really interesting question, and it has been touched on before, because I think that there are patterns that have been identified. So it'd be interesting to hear your perspective on this, Dr. Tolu. This attendee wants to know, is there a connection between the long-term effects of COVID and menstrual cycles? That may not be, I guess, no question, but if you have any insights to bring to that, that would be helpful.
So my first response is, I think so. And I think part of that is because we're still trying to figure out what the long-term effects of COVID are, right? And so my question is it somebody who actually was sick, or are you talking about all that happened because of COVID? There are so many unanswered questions with long COVID that I'm hesitant to delve into too much. But I will just say to you that yes, anecdotally, we're hearing, cycles suddenly went wacky, or cycles have gotten heavier, or cycles have become more painful, or now there's joint pain with the cycle. So I guess what I would say to your question is yes, and to be continued.
Great. That makes me think that maybe we should save. I know, like you said, there are a lot of unknowns. This is still, it's a novel virus, but I think it may be beneficial for some if we do a potential future blog post around long haul COVID and various ways that particular modalities within natural health or integrative health could be helpful for easing those symptoms. The next question is it true that the mark of menopause is being without a period for 1 year? And are there any other things that are measured that determine when a woman is in that phase? That's a great question.
Yeah, so 6 months if you've had really regular cycles, a year if you've had somewhat irregular cycles. But yes, if you've gone without bleeding for a full year, you have probably entered menopause. Menopause can be quote unquote diagnosed with some blood tests. You're usually looking at an assessment of follicle stimulating hormone, FSH. The high levels of FSH above a certain benchmark are also a marker for menopause. But if I can just say something along those lines that I think is worth mentioning in this context, which is if you have gone without bleeding for a year and then you start bleeding again, don't consider that to be the return of your cycles. If you start bleeding again after that long break, and it's not because you've taken estrogen replacement therapy or some other hormone, that could be evidence of some kind of a cancer. Uterine is high on the list, vaginal is probably a second, and ovarian is a third. So my point being that just a cautionary tale out there. If you stop bleeding and you start bleeding again, don't think you're still doing the menopause thing. Go in and get checked right away.
That's a great takeaway, Dr. Tolu. I think that's so many of us, when we have things that kind of go out of whack, we just chalk it up to our crazy hormones. But that's a great marker to look for and to use when making an appointment to get that checked out. Our next attendee, and we only have a couple of minutes on the clock here. Does Dr. Tolu see patients? If so, is she accepting new ones? And how do we go about with contacting her to schedule an appointment?
I don't see patients anymore. I quote unquote retired in quotation marks. I don't think you ever really do retire, but I'm happy to have a conversation at any time. Just feel free to contact the school and Northwestern Health Sciences University, and they can pass the call on to me. So I'm happy to have a conversation anytime.
Oh, that's so wonderful. If somebody could add in Northwestern's general number into the chat box, that would be really helpful. And lastly, I don't know if we may have touched on this already. This person says, I have the same question above around menopause/perimenopause. Can Dr. Tolu, I guess we've kind of covered this. Can Dr. Tolu explain in basic terms what happens to our bodies in this phase?
Yeah, you go from high intensity hormones going kind of crazy as they reset now for the menopause to really low intensity hormones. So you're part of the process is initially your brain starts to recognize that the estrogen and progesterone levels are declining. And so the first response is, well, let's do something about that. So let's fire more FSH, follicle stimulating hormone, and get more estrogen in the system. And over time, and so what happens is you end up ovulating less frequently, but you still do ovulate, but just not as consistently. Plus, the brain is working harder. So you sort of get all these hyperactive type symptoms that come with your brain just saying, oh, something is going on. And then things start to regulate as far as the change is concerned. The ovarian follicles stop producing estrogen. The shift now goes from ovaries to adrenals in terms of the production of your hormones. And like, if I could just say a quick note about that, is that be mindful of how we use our stressors, right? Is that you need your adrenal glands functioning into menopause, in part because you still need that adrenal gland derived production of estrogen and progesterone from fatty tissue. So plan for menopause ahead of time by managing life and not overstressing as you go through life. But then, yes, then you get the menopause and things do calm down and settle down. And hopefully you have enough fat on you, you balanced your adrenals well so that you get enough production that things can stay level and carry you through that menopausal period.
And this is a great final question. Lisa wants to know, is there another practitioner at the Bloomington Clinic that you would recommend in your place, since you're retired, who specializes in women's health?
Yes, there are quite a few. I'm just trying to think of who is there right now as we speak. Dr. Amy's there. Dr. Ann is there.
Is it Dr. Horton or Mueller?
Yes.
Okay.
And who else is there? If you just called up the Bloomington Clinic and asked for who the practitioners who do the women's health, he's Dr. Barb, Barb Gossie's there as well. She's an acupuncturist. There are quite a few that do women's health at the Bloomington Clinic still.
Would Jessica Fryer be another good one, Dr. Tolu?
Yes, if she's still seeing patients. I'm not sure if she's still seeing patients up at the Bloomington Clinic, but if she is, then yes.
Okay, I'll just add these. I have the Northwestern Health Sciences URL in the chat box for everybody. The general number, Dr. Tolu's full name, and then your recommendations for other women's health specialists. And with that, I think that we're at time. Dr. Tolu Oyelowo, it was such a pleasure to have you today. Thank you so much for being a part of this. I did not know you were retired.
I'm not retired from teaching, just from practice.
Retired.
Yes.
Is there going to be another women's health book, do you think, in your future, Dr. Tolu?
I hope so.
This was probably, I don't want to play favorites, but this is probably my favorite one to date. And obviously, I think we've received the most questions generated for any Wellness Wednesday since we started this back in March. So there's a lot of intrigue and a lot of curiosity around this topic. So that's going to be good for us to kind of think about, and maybe, do a jump off with more blog posts or virtual sessions that are centered in hormonal health and the life stages. For those of you that are worried that you may have missed something or you want to hear something again, we always post a recording of this webinar on the Wellness Wednesday page. And that will be up within the next day or so. So stay tuned to that, or you can go to YouTube, type in MSP Mag, and all the videos are archived there as well. And then while you're on the Wellness Wednesday page, you can check out the upcoming schedule of topics. I think we have 2 left. And well, yeah, we're in October, we have 2 left. So next month we'll be diving into the basics, the ABCs of Ayurvedic medicine. And I believe the following month is going to be all about adrenal fatigue. There's a lot of intrigue with that topic as well. Again, we want to give a major thanks to Dr. Tolu Yellow for the gift of knowledge and her gift of time. And last but not least, thank you to Northwestern for sponsoring this great series. Don't forget to sign up. Our door is always open, so let us know what you want to hear about in the natural healthcare realm. Thanks so much, everybody.
Thank you. Thank you for having me. Take
Thank
care.
you.
Bye-bye.
Bye-bye.